blood oxygen levels indicate the quantity of oxygen present in the bloodstream. Typically, normal blood oxygen levels range from 75 to 100 millimeters of mercury Hg as indicated by arterial blood gas ABG test results. Let's talk about signs of low oxygen levels in the blood. Low oxygen levels in the blood, also known as hypoxemia, can manifest through various signs and symptoms. Here are 6 common signs. First sign, shortness of breath, dyspnea. Difficulty breathing or feeling like you can't get enough air is one of the primary symptoms of low oxygen levels. This may be particularly noticeable during physical activity or when you're at a high altitude. Second sign, confusion or changes in mental status. Hypoxemia can affect cognitive function, leading to confusion, difficulty concentrating, or even disorientation. Third sign, blue discoloration of the skin or mucous membranes, cyanosis. When oxygen levels in the blood are significantly low, it can result in bluish tinting of the lips, fingers, toes, or even the skin in severe cases. This occurs because of the bluish hue of deoxygenated blood. Fourth sign, rapid heart rate, tachycardia. Your heart may start beating faster in an attempt to deliver more oxygen to the body's tissues, compensating for the decreased oxygen in the bloodstream. Fifth sign, chest pain or discomfort. Low blood oxygen levels can cause chest pain or discomfort, which may feel like pressure, tightness, or a squeezing sensation in the chest. This symptom can be alarming and should be evaluated promptly by a healthcare professional. Sixth sign, fatigue or weakness. Low oxygen levels can lead to feelings of fatigue or weakness, as your body may struggle to carry out normal activities due to inadequate oxygen supply to the tissues and organs. It's important to note that these signs can vary depending on the severity of the hypoxemia and individual differences in how people respond to low oxygen levels. If you experience any of these symptoms, especially if they're severe or persistent, it's crucial to seek medical attention promptly. Risk factors of low blood oxygen levels. Low blood oxygen levels, or hypoxemia, can result from various underlying conditions or circumstances. Several risk factors can predispose individuals to experiencing low blood oxygen levels. First risk factor, lung diseases. Conditions such as chronic obstructive pulmonary disease (COPD), emphysema, chronic bronchitis, asthma, pneumonia, or pulmonary fibrosis can impair the ability of the lungs to adequately oxygenate the blood. Second risk factor, heart conditions. Certain heart conditions, including congestive heart failure, heart attack, myocardial infarction, and congenital heart defects, can lead to decreased oxygen delivery to tissues. Third factor, high altitude. Being at high altitudes where the air is thin and contains less oxygen can lead to hypoxemia, particularly if one is not acclimatized to the altitude. Fourth risk factor, sleep disorders. Conditions such as sleep apnea, characterized by pauses in breathing during sleep, can disrupt oxygen levels in the blood, leading to intermittent hypoxemia. Fifth risk factor, anemia. Anemia, a condition characterized by low levels of red blood cells or hemoglobin, can reduce the blood's ability to carry oxygen to tissues and organs. Sixth factor, obesity. Obesity can contribute to breathing difficulties, such as obesity hypoventilation syndrome, which can result in inadequate oxygen levels in the blood. Seventh risk factor, smoking. Smoking damages the lungs and can lead to chronic lung diseases, increasing the risk of hypoxemia. Number 8. Environmental factors. Exposure to pollutants, chemicals, or toxins in the air can impair lung function and contribute to low blood oxygen levels. Ninth risk factor is aging. Older adults may be at increased risk of hypoxemia due to age-related changes in lung function and the presence of underlying health conditions. 10th factor, certain medications. Some medications, such as opioids or sedatives, can depress respiratory drive and decrease breathing rate, potentially leading to hypoxemia. It's important for individuals with risk factors for low blood oxygen levels to monitor their symptoms closely and seek medical attention if they experience signs of hypoxemia, such as shortness of breath, confusion, or cyanosis. Prompt diagnosis and management of underlying conditions are essential for preventing complications associated with hypoxemia. Thank you for watching this video. Don't forget to subscribe my channel and press the bell icon.